Hello all. In today's video, I'm going to detail you about the diet for type 2 diabetes mellitus. As you all know, diabetes is a chronic metabolic disorder. It's now becoming one of the main threats to human health, both in developed and developing countries. There has been an explosive increase in the number of people diagnosed with diabetes in recent decades worldwide. Faulty dietary habits and a sedentary lifestyle are the major factor for the rapid rise of diabetes mellitus. Diet plays a strategically crucial role in the prevention and management of type 2 diabetes mellitus. To adopt such a dietary approach, the knowledge of the effect of the diet on the regulation of glycemic levels and the associated metabolic dysfunction is a mandate. This presentation summarizes the importance of macronutrient, micronutrient intake and physical activity for people with type 2 diabetes. Now, coming to the goals of nutrition therapy. The first goal is to promote and support healthful eating patterns, emphasizing a variety of nutrient-dense foods in appropriate portion sizes. So, we are inculcating a healthy eating pattern with nutrient-dense foods in appropriate portion sizes to improve overall health, to achieve and maintain body weight, attain individualized glycemic, blood pressure, and lipid goals, and to delay or prevent the complications of diabetes. Second goal is to address individual nutrition needs based on personal and cultural preferences, health literacy, access to healthful foods, willingness and ability to make behavioral changes. Third goal is to maintain the pleasure of eating by providing non-judgmental messages about food choices while also reducing or limiting certain foods. Fourth goal is to provide an individual with diabetes the practical tools for developing healthy eating patterns rather than focusing on individual macronutrients, micronutrients, or single foods. Now, among the macronutrient intake, carbohydrate is the first one. Dietary carbohydrate includes sugar, starch, and dietary fiber. The carbohydrate intake should emphasize nutrient-dense carbohydrate sources that are high in fiber and minimally processed. That is, complex carbohydrates should be consumed by a person with type 2 diabetes. Higher intakes of sugar are associated with weight gain and a greater incidence of dental caries, whereas higher intake of dietary fiber are associated with reduced non-communicable disease, premature mortality, improvement in body weight, cholesterol concentrations, and blood pressure. With this guidance in mind, eating plans should emphasize non-starchy vegetables, fruits, legumes, and whole grains, as well as dairy products with minimal added sugars. The dietary fiber, the American Diabetes Association recommends that adults with diabetes should consume high fiber foods, at least 14 grams fiber per 1000 kilocalorie. Suppose if a person is consuming 2000 kilocalorie, he or she has to consume about 28 grams of fiber. Recommended food sources of dietary fiber are minimally processed whole grains, vegetables, whole fruit, and legumes. Starch comprises most of carbohydrates consumed globally and is the storage carbohydrate found in refined cereals, potatoes, legumes, and bananas. Next is sugar. Sugar can be either in the form of sucrose, fructose, lactose. Sucrose is also known as table sugar. It provides 4 kilocalories per gram. There is rationale to promote a reduction of sugar intake and replace sugar sweetened beverages, including fruit juices, with that of non sugar containing substances. Fructose is naturally found in fruits, some vegetables, and honey. Fructose consumed from naturally occurring fruits such as fruit that also contain fiber may result in better glycemic control compared with isocaloric intake of sucrose or fructose added to food. Non-nutritive sweeteners provide insignificant amount of energy and elicit a sweet sensation without increasing blood glucose or insulin concentrations. There are several FDA-approved sweeteners found to be safe when consumed within FDA acceptable daily intake amounts. Practical tips for carbohydrate intake. First one is base meals and snacks around high fiber foods such as whole grains, vegetables, whole fruit, and legumes. Second one is common whole grains include whole wheat, whole oats, brown rice, barley, and quinoa. Third is consume fruits, but choose whole fruit over dried or juiced or further processed fruit. Fourth one is legumes are an excellent and cheap source of fiber and protein. Replace ground meat in meals such as casserole with lentils or legumes. Fifth is try to include a variety of vegetables in your meal each day, avoiding deep fried and heavily salted options. Now, the second macronutrient is fat. People with diabetes should replace saturated and trans fat in the diet with mono and polyunsaturated fat to lessen the increased risk of cardiovascular disease. Recommendations from the Academy of Nutrition and Dietetics for healthy individuals are 20 to 35% of total energy should come from fat. The American Diabetes Association focuses on fat quality and its sources rather than quantity. Recommends a Mediterranean eating pattern which is rich in mono and polyunsaturated fats and long chain fatty acids such as fatty fish, nuts, and seeds. So this is the facts on fat. The American Heart Association recommends replacing fat, that is saturated fat, with good fat, unsaturated fat, as a part of a healthy eating pattern. Now, in this picture, here we have Lovit. Lovit is unsaturated poly and monounsaturated fats. Examples: olive, avocado, fatty fish, and nuts and seeds. So this unsaturated poly and mono fatty acids, they lower the rate of cardiovascular and all-cause mortality, lower bad cholesterol and triglyceride level. They provide essential fats to your body needs but can't produce itself. Next is limited. So we have to consume saturated fat in limited amounts. Example is butter, heavy cream, cheese, and fat, flesh of pork, chicken, mutton, all these things. This saturated fat increases risk of cardiovascular diseases and also raises bad cholesterol level. So we have to consume them in limited amount, whereas lose it. We shouldn't take it completely. We should avoid it completely. Examples: artificial trans fats, hydrogenated oil, and tropical oil. These trans fats, hydrogenated oil, and tropical oil, they increase the risk of heart disease, also raise bad cholesterol levels. So these are the types of fat and the main sources. So coming to monosaturated fat, we usually consume canola oil, peanut oil, olive oil, avocado, nuts such as almonds, hazelnuts, seeds such as pumpkin and sesame seeds. So to have a monosaturated fatty acid in our diet, we have to consume one of this as a source. Then coming to polyunsaturated fats, sunflower, corn, soybean, and flaxseed oils, and also in foods such as walnuts, flax seeds, and fatty fish. Coming to saturated, we have to consume this in limited amount. They are whole milk, butter, cheese, and ice cream, red meat, chocolate, coconuts, coconut milk, coconut oil, and palm oil. Though this coconut oil and palm oil are plant sources, they are saturated and we should consume them in limited amount. Next is trans fat, some margarines, vegetable shortenings, partially hydrogenated vegetable oil, deep fried foods, fast foods, some commercially baked foods. That these baked foods, they contain trans fats. That is, the fat after cooking, it will be in form of a coating, like wax-like coating on the surface of the food. We should not consume them. Next, coming to protein. Protein intake goals should be individualized based on individuals' current eating pattern. The American Diabetes Association 2024 states that the daily level of protein intake should be 1 to 1.5 gram per kg body weight per day, or 10 to 20% of the total energy. So these are the practical tips for protein intake. Ideal plant protein sources include legumes, lentils, tofu, and tempeh. Nuts or oil seeds are encouraged, such as almonds, cashews, hazelnuts, peanuts, pecans, walnuts, sunflower, pumpkin seed, or linseed. Nut butters are also a plant-based protein source, but should be mindful. We should avoid the addition of sodium and sugars in nut butters. Good sources of lean animal protein include skinless poultry, low-fat cuts of beef or pork, fish or egg, and reduced fat dairy products. Next, target guidelines for micronutrients. There is no clear evidence that dietary supplementation with vitamins, minerals, herbs, or spices can improve outcomes in diabetes management when there are no underlying deficiencies. That is, when you are consuming the vitamins and minerals in the required amount, there is no need for supplementation. Now, coming to vitamins. Since type 2 diabetes is a state of increased oxidative stress, interest in recommending large doses of antioxidant vitamin has been high. Current studies demonstrate that no benefits of carotene and vitamin E and C in respect to improved glycemic control or treatment of complications. And the patient those with metformin therapy are at high risk of B12 deficiency and may need vitamin B12 supplementation if the laboratory tests indicate a deficiency. Next, coming to minerals, as for the general population, those with diabetes should limit sodium consumption to 2,300 milligrams per day. At present, there is insufficient evidence to make recommendations for people with diabetes to take magnesium, chromium, herbal supplements, and a probiotic for glycemic control. Next, coming to the consumption of alcohol, updated guidelines of American Diabetes Association 2024 recommend that there is no safe level of alcohol consumption. Adults with diabetes who choose to drink alcohol should do so in moderation, not more than one drink per day for adult women and not more than two drinks per day for adult men. Alcohol consumption may place people with diabetes at increased risk of hypoglycemia, especially if they are taking insulin or insulin secretagogues. Next, carbohydrate counting. This is a tool to manage and to easily estimate the amount of carbohydrate in a particular food and adapt their insulin therapy accordingly. Setting a target carbohydrate intake for each meal allows those with diabetes to better match their carbohydrate intake to the appropriate mealtime insulin dose. The patient is consuming more carbohydrate. Like after counting the carbohydrate, he comes to know that he or she has consumed like 60 gram instead of 40 gram of carbohydrate. So what can he do? He can increase the amount of insulin so that it will work well. The potential advantages of carbohydrate counting include improved glucose control, flexibility in food choices, better understanding of how much insulin to take, and simplification of meal planning. So these are the nutrition behaviors to be encouraged in a diabetes patient. So vegetables, They can consume dark green, red, and orange in color, fresh, frozen, or low sodium canned. Legumes, they can consume dried beans, peas, and lentils. Fruits, especially whole fruit, and fresh fruit is mostly accepted, whereas frozen or canned or juices, they can be avoided. Whole grain foods were culturally appropriate. Whole grain versions of commonly consumed foods such as 100% whole wheat breads or pastas and brown rice. When not culturally appropriate, focus more on portion control. Foods with at least 3 gram of fiber per serving, which generally indicates of foods high in fiber. Water should be the primary beverage of choice. For individuals who do not prefer plain water, no calorie alternatives are the best choice. Options include lemon juice, cucumber slices to water, sparkling no calorie water, flavored no calories water, no calorie carbonated beverages, etc. Plant-based proteins can include legumes like soya beans, pinto beans, black beans, garbanzo beans, dried peas, lentils, nuts, and seeds. Meat and poultry should be from fresh, and if it is canned, it should be low sodium, chicken breast, and ground turkey. Heart healthy, wild caught fatty fish such as salmon, tuna, sardine, and mackerel. Use herbs and spices to season foods instead of adding salt or salt containing preparations. Incorporate onion, garlic, celery, carrots, and other vegetables as a base for preparing various homemade foods. Cook with vegetable oil in place of fats high in saturated fat. Meal preparation by planning out meals for the whole week. Grocery shopping with a list and cooking on a day off so they are ready to eat and ready to reheat homemade meals waiting in the fridge or freezer. Include family or roommates in meal preparation. Share the responsibilities of grocery shopping and cooking. Next is hypoglycemia treatment. Hypoglycemia is defined as low blood glucose levels below 70 milligram per deciliter. And symptoms include anxiety, irritability, lightheadedness, and shakiness. Advanced symptoms include headache, blurred vision, lack of coordination, confusion, anger, and numbness in the mouth. Hypoglycemia must be treated immediately with glucose. Follow the 15 by 15 rule. That is, take 15 grams of simple carbohydrate, which should increase blood glucose by 30 to 40 milligram per deciliter within 15 minutes. When hypoglycemia occurs, have one of the following quick fix foods. That is 1 tablespoon of sugar or honey or corn syrup. Hot candies, jelly beans, or gumdrops. 4 ounces of juice or regular soda. Should not consume diet coke. Glucose tablets. Then, if you have gel tubes, you can use them. These are the symptoms of hypoglycemia, and like you have to consume one of these foods immediately when the blood sugar level goes down. How can you prevent hypoglycemia? To help prevent hypoglycemia, following guidelines should be followed. Don't skip or delay meals or snacks. Monitor blood glucose closely. Take medication as recommended by the physician. Adjust medication or eat additional snacks if physical activity increases. The adjustment depends on the type and length of the activity. Eat a meal or snack if choosing a drink with alcohol. Drinking alcohol on an empty stomach can contribute to hypoglycemia. Record low glucose reactions. This can help the healthcare team identifying patterns contributing to hypoglycemia, and you can find a way to prevent them by discussing with the doctor and dietitian. So how to manage a sick day? Eating and drinking can be a challenge when sick. The main rules of sick day management are the usual amount of carbohydrate divided into smaller meals and snacks if necessary. Drink non-caloric, caffeine-free fluids frequently. Continue to take diabetes medication, oral drugs, or insulin. Self-monitor blood glucose levels. Coming to physical activity, it can improve glycemic control. People with diabetes should be encouraged to undertake regular physical activity to improve cardiovascular and overall fitness, weight control, and for improved psychological well-being and quality of life. Low intensity physical activity is safer than high intensity physical activity and highly beneficial for those with diabetes. People with diabetes are encouraged to undertake at least 30 minutes physical activity each day with modalities such as walking is recommended. These are the references. Thanks for watching.